Assalamualaikum warahmatullahi wabarakatuh. My name is Airil bin Azli, UDB 220281, and today me and my group will present about our research project, which is the factors that influence Kelantanese to go receive medical treatment. So first, I will present about the problem statement of this project. So the first problem is lack of awareness from Kelantanese people themselves. They may not receive formal education, or people telling them about how important health is to the human being. So the second problem is monetary reasons. Because medical costs are high nowadays, it may be become a big issue for people in general to not go have professional medical treatment. The last problem is convenience. Most of the places in Kelantan are not located in a highly populated or highly dense area, so they may not have a lot of clinics or hospitals, and also maybe because of the working hours or office hours of the clinics itself to provide medical treatment to potential patients. Okay, now I will present about our research questions that we ask our respondents in the questionnaire. So as we know, we have three problem statements, which are convenience, monetary, and awareness. So I will give one example of the questions from each problem. So first is convenience. The example of our question is how far is the nearest clinic, because that can affect whether or not Kelantanese people or just people in general should go to the clinic or hospital. So yeah, the distance between their house and the clinics and hospitals play a big part that influences this problem. So the next one is monetary. So the question is, are cost the main reason? Because medicine nowadays, especially nowadays, are getting more expensive by the day, and many people can't afford the medicine, because the medicine sometimes costs 70 ringgit to 80 ringgit, depends on the medicine you get, plus the consultation that you get from the doctor also costs money. So yeah, that is one of the main reasons why people don't go to the clinic or hospital. So the last one is awareness, and the question is, have you received any formal education about health? Receiving formal education, or just having knowledge in general about health can influence yourself and other people around you to go to the clinic and receive medical treatment. Because if you don't have any knowledge about for example illnesses like COVID-19 or H1N1, that can make you not go to the clinic and not even prioritizing your health and taking care of the illness, and receiving professional medical treatment to to remove the illness from your body. So that is why knowledge about health is very important. Okay, last but not least is research objective. So the research objective is constructed by the problem statements. So the first research objective is to analyse if awareness contributes to Kelantanese people not going to the clinic or hospital to receive professional treatment. The second one is to identify whether monetary reasons affect Kelantanese people to not go to the clinic or hospital to receive professional medication. And last one is to determine the convenience factor to be the reason for Kelantanese people to not go to the clinic or hospital to receive medical treatment. So that's all from me. Thank you.
Assalamualaikum. My name is Nadia Farhana binti Muhammad Zawawi. My matric number is UDB220273. I will continue the presentation to present about literature review. In this study, we use the health belief models (HBM) to understand healthcare seeking behavior, focusing on perceived susceptibility, severity, benefit, barriers, choice to action, and self-efficacy. It was developed in the 1915 by social psychologists at the US Public Health Service. The HBM perceived that people are more likely to take health-related action if they perceive themselves as susceptible to a serious condition, believe the benefit of taking action outweigh the barriers, and are confident in their ability to successfully perform the action. Quest in the environment can also trigger health behavior. While widely used, the HBM has some limitation. It doesn't not account for habitual behavior, social influencer, or environmental factors that may impact health action. The model is more descriptive than explanatory and does not provide a clear strategy for changing behavior. Integrating the HBM with other models may provide a more comprehensive approach to understanding and promoting health behavior. Convenience plays a crucial role in healthcare accessibility, encompassing factors such as accessibility, efficiency, comfort, and user-friendliness. The lack of this element can deter patients from seeking medical care. Inconvenient location and insufficient parking, making it difficult for patients to access facilities. Long waiting times and inefficient process, which can be time-consuming and frustrating for patients. Unfriendly or stressed healthcare staff, creating an unwelcoming environment and encouraging patients from sharing their concern openly. Lack of privacy during consultation, making patients uncomfortable discussing sensitive health issues. Communication problems and lack of empathy from healthcare provider, leading to discomfort and disinclination to seek care. Dissatisfaction with physical facilities condition such as small and shared consultation rooms. Lack of awareness and promotion of available health service, especially for sensitive issue. Prioritization of work over health, leading to reluctance to seek timely care. Difficulty in continuing medication prescriptions at different clinics, posing a challenge for those who travel frequently. Overcrowding and long wait time at public healthcare facilities, encouraging people from seeking care, especially for a non-urgent issue. Monetary factors such as the high cost of healthcare, poverty, fear of incurring large medical bills, and unfair pricing at public facilities are significant barriers that prevent some Kelantanese people from seeking professional medical treatment. Many Kelantanese, especially those living in rural areas, struggle to afford basic necessities, let alone expensive medical bills. The average cost of a single visit to a private clinic in Malaysia is 15 to 100, which is a significant amount for those living on low incomes. Even when public healthcare is available, indirect costs like transportation and cost wage can deter people from accessing service. The fear of incurring large medical bills leads some to delay or avoid seeking care until their condition become severe. Additionally, the differential pricing system at public healthcare facilities, where foreigners pay higher fees than Malaysian citizens, is perceived as unfair and a barrier to accessing care. Addressing this monetary barrier through measures such as subsidies, universal health coverage, and fair pricing policies is crucial to ensuring equitable access to healthcare for all Kelantanese people. The concept of health awareness refers to individuals' understanding and knowledge about modern healthcare practice, the importance of seeking medical help when needed, and the factor influencing their healthcare seeking behavior. Encompasses being informed about the benefit of professional medical treatment, recognizing symptoms that require medical attention, and being aware of available healthcare service. The study highlight the importance of education in shaping healthcare seeking behavior. Those with higher education level tend to have a better understanding of modern healthcare and are more likely to seek treatment at government hospital or clinic. In Kelantan, various factors contribute to individuals reluctant to seek professional medical treatment, like unfavorable perception and fear associated with medical care, such as apprehension about receiving a serious diagnosis, discomfort with physical examination, and belief that doctors are linked to negative outcomes, low trust in healthcare providers, and a perception that symptoms are not severe enough to warrant medical attention. Practical obstacles, including lack of insurance, language barriers, and past negative encounters with the healthcare system. Socioeconomic factors like lower income level and limited education. Cultural and religious belief that prioritize traditional or alternative medicine over Western practice, limited health literacy, especially in rural areas, leading to undervaluing the benefit of visiting clinic or hospital. Traditional had belief that emphasize spiritual and herbal remedies over Western medicine. This distrust of the healthcare system due to past negative experience, maybe stigma surrounding certain health conditions such as mental illness or sexual transmitted infection. Gender norms that make some women uncomfortable with male healthcare providers, accessibility challenges in rural areas, including lack of transportation and high costs, to improve healthcare seeking behavior that promote better health outcome in Kelantan. Strategies such as community-based health education, collaboration with traditional healers, and improving accessibility and cultural sensitivity of healthcare service are crucial. This is a theoretical framework. The independent variable proposed to have a positive relationship with Kelantanese people refusing to go to clinic or hospital for special medical treatment are convenience, monetary factor, and awareness. Location and parking, inconvenient parking and clinic location deter people from seeking medical care, especially if they have to park far away. Consultation room or small consultation room lacking privacy make patient uncomfortable. Long waiting time at clinic and hospital discourage people from seeking care too. Difficulty accessing clinic, especially in rural areas, and conflicting clinic hour with work schedule pose challenges. Second variable is monetary cost. While medication supply and service satisfaction are generally good, indirect costs like transportation and time of work can discourage seeking care. Another that unexpected costs, concern about hidden or unexpected costs during treatment can also deter people from visiting clinic. Last variable is awareness. Health seeking behavior men tend to seek treatment only for severe illness and prioritize work over health, contributing to poor health seeking behavior. Preference for traditional medicine, cultural belief favoring traditional medicine as the first line of treatment, and low health literacy impact health seeking behavior. Stigma and gender norms. Stigma around certain health condition and gender norms discouraging men from proactive health behavior also influence people reluctant to seek professional medical treatment. That's all from me. I will pass to the next presenter.
Assalamualaikum. My name is Muhammad Arsh Daniel bin Muhammad Nazri, and my matrix number is UDB 220271. So I'm going to present about research methodology. So the first part is about what is research methodology. Research methodology is the overall plan for how a research project will be carried out. It includes the research methods and data analysis technique that will be used to answer the research question or test the hypothesis. We collected information regarding the Influence Kelantanese to seek professional medical treatment straight from them through primary research. This approach was chosen due to the lack of existing studies on this topic. We distribute a Google Form survey, which allow us to reach a wide audience and collect diverse demographic information and opinion on healthcare. This method provide accurate current information directly relevant to our study. Although primary research is time-consuming and challenging, especially in reaching isolated individual, its benefits include obtain precise and comprehensive data, offering helpful information and information into the reason behind the influence of Kelantanese people to seek professional medical care. And the next part is about data collection method. This research that we made, we collect the data from the public by distributing Google Form to the public. The research that we give to the public is called quantitative method. The reason that we use quantitative method is because we want to observe the cause and effect and make prediction about factors that influence Kelantanese to seek professional medical treatment in clinics or hospital. Our group selected in this research is a large scale and selected randomly. Another reason why we choose a quantitative method is because this method use number and statistic rather than words or image. With this method, it is easier to observe and make a conclusion with stated facts. The third part is sampling plan. For this research, we choose to use non-probability method. To be specific, the sampling method of non-probability method is convenience sampling. Convenient sampling means the collection of information from members of the population who are conveniently available to provide it. The convenient sampling is very often used by researchers in order to cover the large number of survey quickly and cost effectively. The majority of the population around us are born in Kelantan, so the information we need can be sampled from them. And the last part is analysis plan. This research was analyzed by using Google Sheet. Qualitative analysis was used in this research. The demographic profile of the target respondent was described using tables, graph, and written explanation by means of qualitative analysis. The mean and standard deviation were used to quantify central tendencies. This demographic profile includes age, gender, high education level, ethnicity, and income level. That's all for me. Thank you.
Hello, my name is Muhammad Naufal Najmuddin bin Muhammad Najib, UDB 220282. So, I will continue the presentation with data analysis in chapter 4. So, I will present our finding on the factor of influence Kelantanese in seeking medical treatment based on our survey of 157 respondents using the Google Form platform. Based on our survey, our average respondent is between 18 to 24 years old. Half of them is male and earning 1,500 until 2,000 per month. Majority is Malay ethnicity and holding a diploma or STPM qualification. In our research, there were 3 variables, which is convenience, monetary, and awareness factors. So we go to convenience first. Our data reveals that 93 respondents, which 56.6% of respondents have a short drive to the clinic or hospital. In contrast, 44 individuals face a long drive, while 20 respondents can conveniently walk to the healthcare facility. Secondly is monetary factor. Monetary factor play a significant role in healthcare decision. According to pie chart, 90.4% or 142 respondents believe that the medicine they purchase work effective. However, 15 of the respondents feel like the medicine doesn't work well. Lastly, awareness factor. Awareness of treatment option is also crucial factor. Our questionnaire indicates 83.3% of respondents or 130 individuals are aware of available treatment option for specific medical condition. In contrast, only 26 respondents are not aware. In conclusion, the three variables, which is convenience, monetary, and awareness factor, significantly influence the medical treatment of Kelantanese individuals.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Natasha Nabila binti Muhammad Karim. My matrix number UDB 220280. I will continue the presentation, which is conclusion. After we finish this research, the finding for factor that influence Kelantanese to receive professional medical treatment is monetary. Money is the main variable that affecting healthcare decision among Kelantanese individual. The analysis show that the cost of medical treatment is an important determinant in the decision-making process for the Kelantanese to get treatment. This availability of healthcare service has a significant impact on whether an individual is seeking the necessary medical assistance in a short time when they're in an emergency. Sometimes those with lower personal income will think before they spend their money to get medical treatment. Other people with high personal income generally can afford to have medical treatment, including checkup, specialist consultation, and advanced medical treatment to keep their health. Research on factors that influence Kelantanese to have medical treatment is for policymakers and government agencies. By comprehending social life pattern, they can devise more efficient action plans to improve the system and more about medical treatment. Government agencies can use this research to develop policies that address barriers to access to medical care. For an example, if financial constraints are a major issue, policy may focus on increasing healthcare subsidies or expanding insurance coverage to the Kelantanese. This research also is essential for infrastructure investment at the Kelantan. Understanding where and why people do not go to get medical treatment can help government agencies allocate resources more effectively. This means ensuring that funding is directed to the area that need it most, whether it is improving infrastructure, indoor clinic, increasing the number of healthcare professionals in less served area, or investing to more medicine. When conducting research into the factors that influence the decision of the minority community to obtain medical treatment, some ethical considerations must be carefully considered to ensure the protection and well-being of participants. The participants' information must be anonymous and stored securely to protect their privacy. In addition, as a research, we must respect the autonomy of the participant from imposing personal belief and ensure that healthcare decisions remain entirely voluntary.